Hi, this is Amanda. Welcome to the Lymph Info Show. Another show this month. We're talking about chronic venous insufficiency and how that leads on to Flebo Lymphedema. So just as a bit of an explanation, chronic venous insufficiency is a vascular disorder, so that means that the veins aren't working as they should, and we often just refer to it as poor circulation. In extreme cases, it's when you start seeing people with the purple ankles and they start having problems with swelling, which is as we start moving into the Flebo Lymphedema. So we know that Flabber Lymphedema is the most common form of lymphedema in the Western world. So we know that filariasis infection most common around the world because of the dense population numbers that we get in a lot of developing countries. But in terms of the Western world, we're looking at 7% of people over 50 and 20% of people over 70 developing Flebo Lymphedema. We know that it's combined with vascular and lymphatics, and that causes inflammation and edema in the feet and lower legs. So that begins with chronic venous insufficiency, and what happens is the veins, which are one-way valves, so the blood's always meant to flow towards the heart, those valves get a bit sloppy and they start to back up. The blood starts to pull backwards, it starts to flow backwards, and it can't, in worst cases, it just can't get out. So that means there's extra tissue in there's extra fluid in the tissues. So that's when you start getting that extra swelling, and that staining that we talked about, that colouring of the ankles, that's the blood cells sticking around and not leaving and not being removed and processed out. So that puts a strain on the vein walls, and the blood plasma leaks into what we call the interstitial space. So that's the space between all the cells and all the tissues. And that's when we get that swelling in the feet, ankles and calves. Now this can be a really debilitating condition. It can be quite painful, and it will usually lead to chronic ulcers. So when we talk about the elderly in particular, or people with poor circulation developing leg ulcers, these are sores that just won't heal. They're open sores and they can last for months, and that can mean that that person is unable to do a lot of things like shower or swim or get out and about and do their exercise. And they're reliant on things like the district nurses coming around and dressing them every day or so, or having someone at home that can do that for them, or if they can't do it themselves. It becomes quite a burden, and it's also a very high risk for infection. So often the wounds aren't necessarily infected themselves, but they certainly can become infected. So what we know is that chronic venous insufficiency, or CVI as I might just keep calling it, it does affect both legs. So we'll see it looks fairly equal. And that might first show up as swollen ankles at the end of the day. And they may come down overnight when your legs are horizontal, but then they'll swell up again during the day. And that's because the lymphatic system's working and it's taking that extra fluid out. As the CVI becomes more advanced, it causes that lymphatic system to get overloaded. It's just working too hard and it can't keep up. And that's when it develops into Flebo Lymphedema. So other symptoms of CVI and Flebo Lymphedema can be those chronic ulcers and wounds, pain. It can become quite itchy, quite irritable. And we know about that susceptibility to infection and cellulitis. You will often see varicose veins with this condition. And I talked about the changes in skin colour, particularly that changing from purple or brown as the blood leaks into the tissues and stains them. And that's a condition known as hemosiderin. And we can also see changes in the textures of the skin. As the fluid increases, it often becomes sort of almost spongy or doughy even. So if you imagine a bit of dough that you're making bread out of and you put your fingertips into, and it'll often leave an indent. That's what I think I've talked before about the pitting test. We know that if we hold our finger into that fluid-filled tissue, we can push the fluid out of the bit where we've just had our fingertips, and it leaves a dent and it looks doughy. The underlying causes can be things such as a family history, pregnancy, inflamed or varicose veins. So that's a really big part of it. Blood clots are another issue. Injury to the area, such as a knock. We often see people developing leg ulcers after they've perhaps been gardening and they've had a knock to the skin, and the system just can't process that. And there's some other lifestyle factors as well, including smoking, lack of exercise or movement, and sitting for long hours or standing for long hours. And obesity is also another another risk factor for CVI that can contribute to making it worse. CVI is diagnosed by getting a full medical history, and it can include diagnostic tests such as ultrasound imaging, what's called an ankle brachial index, and that's when they measure the blood pressure at the ankle and at the wrist or at the knee, and that can give a difference in blood pressure, and it tells them where they're at. There's also lots of other imaging tests that can be done, and medical procedures that treat varicose veins are often part of that diagnosis. Once they've made that diagnosis, they'll often treat the varicose veins, and that can sometimes in some people be enough to arrest that swelling and that edema. There's a few stages of CVI. We know that at stage 0 there's no visible signs of it, so you'll be unaware that you've got it. You won't have any swelling or any prominent veins, and at the very most you'll be needing to do some lifestyle changes, increasing your mobility and getting moving, have a healthy diet, and perhaps some weight loss. Stage 1's when we start seeing signs of it. Those veins start becoming more visible. So you start seeing, you've got spider veins, and they're called, I'm going to get this wrong, telangiectasis. No, forget it, just say spider veins. And they're less than 1 metre in 1 millimetre in diameter, and they tend to be those sort of, we say spider veins because they kind of look like they're crawling out from the area. The other one is reticular veins, and they're a bit bigger, and they're often blue or purple, whereas the spider veins can appear as the very thin red lines under the skin. And at this stage the veins and blood vessels will be visible, but they won't be bulging. And again, lifestyle changes is the best thing to do, but we also start adding in things like compression garments, and this can slow the progression of CVI, and it's the primary treatment. Looking at stage 2, this is when we start seeing varicose veins appear, and those are big veins. They're quite enlarged, and they can look kind of lumpy and protrude from the skin, and they can be treated in most cases. Sometimes they'll return after treatment, and that's what we call a substage of stage 2. But again, the treatment at this stage is exercise, compression therapy, and treatment for the varicose veins, either with a vascular surgeon or a procedural phlebologist. And there's all sorts of really interesting treatments. One of the ones I've heard recently is, and it sounds awful, but they actually inject it with super glue, and it causes the vein to die off and stop being a problem, basically. But the best person to speak to about that would be a vascular surgeon or a procedural phlebologist. Moving on to the next stage, that's stage 3, and that's when the lymphatics become overloaded, and this one is when we start developing Flebo Lymphedema, and so there's more swelling present, and again, compression therapy is the best tool to manage it. We have ways of doing that with compression garments, but there's also a really neat tool called a Sequential Intermittent Pneumatic compression pump. And I have clients who have the classic symptoms of CVI and have developed the swelling and the early stages of Flebo Lymphedema, and we've gotten them into compression garments, and we've done a little bit of reduction with them, and we've gotten them doing daily pumping, and that daily pumping has been really helpful. I've got one client, I don't see her anymore because she's in such great state. She came to me just wanting to be able to wear shoes again. She wasn't able to wear shoes. She had a beautiful collection of shoes, and she was in jandals, and it was quite upsetting for her. She had a job where image was quite important, and so she didn't feel appropriate wearing her jandals to work, so it was important to her to be able to return to that lovely state of skinny ankles. So we did that treatment with her. We got her on a pump first, and then we did that 3-week reduction with her, and after a week and a half she was in knee-high boots, and feeling very, very pleased with herself. She's still got the pump. She bought that outright and she uses it at home every single day, sometimes for twice a day, and it's been an absolute lifesaver for her. So stage 4, this is when the edema progresses further and we start seeing those the changes to the skin, and this is where skincare is absolutely critical. Should already be doing it before then, looking after the skin, making sure there's no wounds, no breaks in the skin, keeping it well moisturised and well nourished. And under stage 4 we've got 3 sub-stages, and that talks a lot about the skin changes. So with that first stage, the surface of the skin will change. It may be red and itchy, and you may get small brown or grey markings also on the skin. For B, those skin changes become more drastic. The texture of the skin will become thick and hard, and you can get scar marks. You often see people who have had leg ulcers have got kind of a starburst scar. It's a white scar and looks a bit like a starburst. 4B can be really painful. And 4C is when the visible veins and blood vessels also develop around the ankles, and then you're getting another one of those star shapes but in blood vessels. Stage 5 has open but healed ulcers developing on the skin. The treatments continue to focus on caring for the skin, preventing and reducing that swelling and supporting the veins to work efficiently to prevent that overload. So again, we're still looking at that compression therapy. We'll look at compression therapy and keep that going throughout the entirety of treatment. Stage 6 onwards, you're looking at active ulcers that really require that ongoing wound care that I talked about, with the district nurses coming around to your home and you have to stay in all day while you wait for them, and you need that taken care of. The ulcers that don't heal do become a serious risk for infection. They can recur, especially if we don't have that ongoing maintenance and management, and the best thing for that is compression therapy. Lymphedema management as a whole, so we're looking at that manual lymphatic drainage, skin care, exercise and compression. So manual lymphatic drainage does help, but the real key there is movement and compression and skin care. There are some complications with Flabber Lymphedema. So that area where we talked about the brownish and bronze areas, that can be known as hyperpigmentation or hemosiderin, as I mentioned before. And it's a permanent staining of the skin, and it's caused by red blood cells leaking out of the veins. The hardened brown patches that can appear after a cellulitis infection, and that's a form of scarring as well. We talked about those star-shaped white scars, and they are often left after an infection or a treated ulcer. The purple varicose veins are quite large and can be painful, and the small red purple broken venules called spider veins, they can be quite visible, and they can, for some people, they can cause discomfort too. Redness with a normal leg temperature that resolves with elevation can be due to that vasodilation. Now, vasodilation means blood vessels that are open and wide. So if we elevate the legs, we can take the pressure off the blood vessels, and they have less pressure on them to be open. So you can reduce that redness and heat, redness with normal leg temperature. Once you're adding in heat, that's when you're getting inflammation and you may be getting infection. That discoloration around the ankles, it can be accompanied by itching, sores, thickened skin, and can all signal a condition called stasis dermatitis, and the skin's become it's not an infection anymore, it's a dermatitis that doesn't change without compression and skin care, and that's often done with dermatology. And a lot of those symptoms can be confused with cellulitis infections, and cellulitis infections require ongoing long-term antibiotic use. So sometimes it takes a good eye to notice what's an infection, what's not an infection. we know that as the CVI progresses, that the skin becomes more inflamed and fragile, and those wounds can form stasis ulcers. And because there's a poor circulation, those wounds are really slow to heal, so they can stick around for a really long time without good management. So any wound that's vulnerable to developing an infection, it's really important to make sure that wound care is started before even beginning to treat the lymphedema. So I've talked a bit about the different options for treatment there. So we've talked about compression therapy being really important, wound care being really important, and we can also add in combined decongestive therapy. So we know that manual lymphatic drainage helps to remove the extra fluid out of the tissues. We know that compression therapy prevents those tissues from refilling. The compression garments and the pumps are really good working in conjunction with each other. Because the pumps can take out the extra that may have added on during the day, and then you can put your garments on and be free for the day. I've got so many clients that once they've pumped, put on their garments, they just absolutely love the reduction that they've had from the pump alone. That means that they can fit their garments quite comfortably. We do know that, really importantly, education is so important. That's why we do these radio shows, so that we can ensure that people are able to make the right lifestyle choices and also get the right information and be able to self-check what their legs are doing and seeing if there's any chance for wounds there or any chance for cellulitis infections. So those are all things which really help to make things better for people with CVI. Diet and exercise is really important. We know that getting the muscle pump moving is just so important for helping to pump the extra fluid out. And when we add in the compression therapy with that, it's a really lovely combination. But movement doesn't, or exercise doesn't have to be going for a run or something like that. It can be movement. We talk to people about sitting at their chairs and writing their name with their ankles, because that will use the muscle pump. And if you see my arms as being the same as a leg, then even making a fist with your hands will pump the blood through your wrists. Same thing with your feet, clenching your toes, drawing on the floor with your toes if your mobility is limited, rolling your ankles. That's all going to activate those muscles and help pump the fluid. So if you've got any questions about Flebo Lymphedema or CVI, feel free to get onto our Facebook page, Lymph Info Trust, and we're happy to answer those for you. And if you've got any questions that you want to place for us to answer in future shows, please feel free to get in touch, and we're happy to do that for you. And we look forward to seeing you next month.